Great. Great. Welcome to the Basic Rights Oregon Queer Town Hall. Thank you all so much for joining us, especially our elected officials here with us tonight, but everybody watching. Thank you all. I just wanted to share the start of a weekly broadcast by Zoom by Basic Rights Oregon, where we'll be sharing information and news that you need and have special guests every Tuesday evening. For the next weeks, months, as long as this lasts. But we're very excited because the original Queer Town Hall was one we had 2 years ago with our LGBTQ elected officials and our people of color elected officials. And we're really excited to have this be our kickoff to a regular Queer Town Hall. And I really want to thank the PSU Queer Resource Center, who's a co-sponsor for tonight, and for our closed captioners, who will be making this event accessible to the hard of hearing community by closed captioning tonight. What we're gonna do tonight is I'm gonna let the panelists introduce themselves, and we'll do that quickly, and then we'll move into some set questions that I have for folks, and then it'll be a chance for you, the audience. Not used to saying that word, not used to having an audience in my guest room, but hey, it's a whole new world starting here. Really excited about having this time to talk about what matters to us as Oregonians and talking about what's happening. And I know it's kind of a hard, scary time. And I think that the opportunity to have a real conversation with our elected officials who are out there every day trying to figure out how to keep us all safe and how we move forward and how we build community in this time, I think is really important. And so let's start, and I'm gonna start, and I know everybody's Zoom shows up differently, but I'm just gonna have our legislators share their name, their district, their pronouns, and anything else that fits in your designated 30-second introduction. So I'm gonna start and do a little clockwise on my screen and start with Representative Power.
Hey everyone, thanks for tuning in. My name's Karen Power. I am a state representative for House District 41. So if you're in Milwaukee, Southeast Portland, a part of Oak Grove, you might be in my district. My pronouns are she, her, hers. And I'm running for my third term. So I've been in an office for 4 years now, running for another 2. I live in Milwaukee with my wife and our almost 4-year-old 2 dogs. It's kind of bonkers these days, but they're fun.
That's great. Thank you. Representative Meek.
Oh, can't hear.
Oh, well, why don't I go to Representative Alonso Leon while Representative Meek figures out his volume.
Hi, everyone. Representative Teresa Alonso Leon here. Represent District 22, which is Woodburn through the north part of Salem. And my pronouns are she, her, hers, and ella. And I live in Woodburn, lived here pretty much my entire life, and super excited to be here. Thank you for the invitation, Nancy.
Thank you. Representative Meek, you want to try again?
Oh, we still can't hear.
Okay. I'm gonna let Rep Sanchez speak up.
Thank you. I unmuted myself this time. I got it.
Awesome.
Sanchez. I'm the state representative for House District 43, which is North and Northeast Portland. My pronouns are whatever you're comfortable with. And I've lived in my district most of my life, actually, off and on most of my life. So very used to my little area of Portland and very excited to be here. Thanks.
Great. Thank you. Senator Manning?
Okay, had to unmute. First off, thank you for this opportunity. Senator James Manning. I have the best Senate district in the state because it's urban and rural. Senate District 7, pronouns he, his, him. And I am honored to be here with my House colleagues. You know, it's really nice to see everyone. You know, we've had some experiences, not good, but we all stuck together. So I am really proud and honored to be here with you. Thank you.
Thank you, Senator Manning. Rep. Nosse. Wouldn't mind introducing yourself. Okay. You know, it wouldn't be a Zoom call without some technical difficulty. So, Rep. Lawrence-Spence, we'd love to hear from you.
Hi, thank you so much, Nancy. My name is Representative Akasha Lawrence-Spence. I represent House District 36. That's downtown Portland, all the way to the South Waterfront, where OHSU is, and then the Northwest and Southwest Hills, all the way to Multnomah Village. I am honored to serve the people of House District 36 and to be here tonight with Basic Rights Oregon and alongside my colleagues whom I haven't seen in a long time. So it's great to be here. I live in the Northwest District with my partner.
Wonderful, thank you. Great.
Oh, sorry, one more thing, Nancy, I forgot.
Yeah.
Pronouns are she, her, and hers. Thank you.
Oh, wonderful. Thank you. Looks like there might be a few technical difficulties for some folks whose microphones aren't working right now, but that's okay. We're gonna maybe just get started, and I'll just say a little bit about Basic Rights Oregon, which I forgot to do, which is we are the state's political advocacy organization, and we have been around since 1996, fighting for LGBTQ equality. And right now we still do that. That is our main focus, with really pretty focused on transgender rights and queer and trans people of color, who've both communities have long been sort of ignored by mainstream LGBTQ organizations. And so racial justice and transgender justice are what we hold dear in this time. And I think that we can go ahead and get started, and folks who didn't get a chance to introduce themselves can do so as we go into the questions. And so I think I want to start today by talking about what is occupying our minds and our daily lives right now, which of course is the COVID-19 crisis. So I'd love to get an update and your perspective on how the state is responding and what we can do to help. So let's have some quick opening comments. We'll start with the Rainbow Caucus folks who are here. So I'm gonna start with Rep. Power.
Thanks, Nancy. And I hope Rob can hop into Rep. Nosse as vice chair of our healthcare committee, has been leading on some of this work. So Rob, if you want to jump in, if your audio is working again, I'm happy to cede to my more elder statesman of our Rainbow Caucus. Okay, I'll start talking and you can shake your head if I'm doing a terrible job. Okay. So Oregon has, I think, had the benefit of being near Seattle. And we saw early on what was happening with the outbreak in Seattle and took action faster than other states did. And we're seeing some of those results now. We are several weeks out from the governor's stay home order. And while that closure has really impacted many of us financially, and our community is having to come together in new ways to face an economic crisis caused by a pandemic that none of us have ever lived through, it's also showing up in really meaningful ways in our greater Oregon community. The benefit of having that early insight and that early action is it appears that Oregonians took it very seriously. And we are flattening the curve faster than other states, which means that we may not see that giant spike that we're seeing happening in other parts of the world and in other parts of our country right now. That doesn't mean that we can stop our social distancing policies right now just because we're not seeing that spike. So I want to encourage everyone to continue to take this seriously. I know it's beautiful outside, but do make sure that you're maintaining that social distance and trying to stay home and away from crowds and people and away from stores. It's imperative that we keep our healthcare and frontline workers and other essential workers as healthy as possible. Relevant to this particular call, I also wanted to talk about the way that this is showing up in our individual lives, because for some of us, we may be staying home and home may not be a household that recognizes us for who we are or is as supportive as we would normally have those systems through friends and community. And I want to acknowledge that's really hard, but this won't last forever. I was reading an article, a great one, earlier today around trying to find ways to find comfort where you can and giving yourself permission to have really frustrated, hurt, upset, sad feelings right now. Over these last couple of weeks, it's been really hard. And I have good friends who have struggled with their mental health pre-existing a pandemic, and this is really impacting them in significant ways because the usual community supports that they have are not available to them right now. So they are trying to find comfort where they can in favorite foods, favorite activities, books, TV activities, and also engaging in online community. And a bunch of people got together for one of my very old friends' birthdays. And these are folks who hadn't talked together in ages, but she reached out and asked for support on Facebook, and people showed up en masse for her. So I want to make sure that you all know, if you're tuning on YouTube, you're not alone. There are people who are always here for you if you're going through things. And the way this is showing up for our LGBTQIA community is different than it may show up for other communities. So I hope you're being safe and taking whatever measures you need to do to keep yourself healthy, physically, emotionally, mentally through this, and know that we're going to come out the other end.
Thank you. Thank you for that. I think that was a great way to start and good reminders for everybody. Rep. Nosse, would you like to chime in? Not sure. Oh, there you are. Hello, I could hear you. Please speak.
Can you hear me? Hi, Nancy.
Yes. There you are.
Am I on mute again?
No, you're not on mute. You're good. You're good.
Okay, it's funny. It's showing that's mute. So hi, Representative Rob Nosse, the state representative for Inner Southeast and Northeast Portland. And I use he, him, and his pronouns. I've served in the legislature now for 3 terms. And I'm sorry I'm a little bit technologically challenged as I try to join this LGBTQ town hall that Basic Rights Oregon is putting on. I have no idea if anybody can hear me or not. I can't hear. If someone's asking me a question, I'm not getting it.
You're good.
Okay. Is there anything you want me to share or talk about?
Oh, sorry. I was asking about COVID. I know that you've, you fought for healthcare for all for a long time. You're been on the healthcare committee, and I feel like just starting with your perspective on how the state is responding and what we can do to help.
Well, I think we can all take a little bit of heart that the things that our state is doing have worked well enough that our governor thought that she could send a bunch of ventilators safely to the state of New York to help out where it's really tough right now. And that gesture to me gives me some hope that we're doing okay in this state relative to how other states are experiencing this crisis. And I don't think that the folks at the Oregon Health Authority feel like we have peaked yet, but we continue to hear from the hospital systems that our intensive care units are not yet overwhelmed by the COVID-19 virus. And I think that that is very good news for Oregonians, that the things that we've put in place through the month of March seem to be working to mitigate whatever might be the worst of this that's still yet to come.
Yeah.
And I feel fortunate to live in a state where we very aggressively expanded access to Medicaid under the Affordable Health Care Act when Obama was president, because it means that a lot of Oregonians have access to good health insurance. And if they're going to need it because of this virus, they're going to be able to have the kind of health care that they need.
Thank you. Next, I would love to get some additional comments from Senator Manning, who's not only representing the Senate tonight, but also has significant incident command experience. So if you want to share some of your thoughts about how Oregon is doing, we'd love to hear from you.
Well, yeah, it's kind of hard following my colleagues, Rep. Nosse and Rep. Powers. They very eloquently spoke truth as to what's actually going on here. I agree with them. I'm really concerned about the healthcare issue that Rep. Nosse brought up, or for the people that don't have healthcare or uninsured. I recently heard about a national-wide survey that says on the testing, not particularly unique to Oregon, but some of the other states where they were saying that testing is free. However, if you are put into a hospital and you don't have an insurance, you can walk out of there if you are blessed to survive with over $40-something thousand in hospital costs. And if you're underinsured, it could be anywhere between $12,000 and $15,000 co-pays and additions. That really bothers me. This pandemic that we're on, some people are really not taking it seriously in terms of what the lasting impacts are going to be on individuals and families. So that really bothers me. I'm optimistic that we will come out of this stronger, but then there's going to be some struggles involved with this. I think the governor did the right thing, the absolute right thing. And I even sent her a text to thank her for her intentional measures and leadership that she chose at the time she chose. Right now, Oregon does look pretty good. But this invisible adversary that we have that's crossing the globe is yet to be defined. We don't know where this thing is going to end up. And one thing's for sure, it does not discriminate. The other part about this is that I look at it from a national perspective, not particularly Oregon, but the impact that it has on communities of color and low income rural areas. In Chicago, the report came back that of all the deaths out of Chicago, 70% were African American. These are people that are forced to ride public transit and have no other means to get back and forth to work. I stay in contact with my law enforcement officials because I'm concerned about our first responders, our police officers. As a former police officer myself, I know what all of the threats or potential threats are out there. This is a new game that we're playing now. So I look at the people that come by and take the trash, pick up the trash, recycling, the postmaster, the mail carrier. You know, we realize now who some of those unsung heroes are that typically we don't view as that way. The supermarkets that are staying open, the people that's going there to stock at night. I think that America, or most Americans, will have a different view of how we are so interconnected, how we are so dependent upon each other, that there is no job that is disgusting. There is no job that is belittling of a person to take on, because we have to have all these components in order for us to make a society, in order for us to survive. You had mentioned about the chain of command a little bit. I certainly agree with that. And I think that Oregon is very fortunate to have my colleagues in the House side who's here right now, and the governor that we have. She is doing an outstanding job. And I support her. I think that everything that she's doing is right. She is intentional. She is methodical. She's weighing all other factors before she make a decision. I think any good leader would be like that. So I like what Bro is doing, because you're showing good leadership. You're showing that we are not through. We have a lot of work to do. And collectively, it's going to take all of us. But here's the big major part about this. We got to care about each other. We got to respect each other. And then we got to promote each other. And I think if we start doing those things and continue to do those things, I think that we're going to come out of this thing in really good shape. But we're in the midst of a battle, believe it or not, that if we don't continue on the path that we have right now, we will fail. So I don't mean to sound like the angel of doom, but I think that, I am very confident. And, again, just to take a look at my colleagues there, I really miss you guys. This is, you don't know, I get a lot of energy when I'm around that. That place that we work is special. Out of 4 million people in this state, there are only 90 of us. Only 90. And we have to do the best that we can. I know your hearts, and I hope that you know mine. I'm going to fight with you because you've been doing the battle, and I'm there to fight with you. Like I tell my colleagues on the Senate side, I'm built for this shit.
Great. Thank you, Senator Manning. Yes, we are very lucky to have such great leadership in our state. And also, you brought up some important points that I wanted to touch upon. I feel like there's some really disturbing news about who's dying of COVID-19 and the racial impacts, the communities of color. I think that, the people who are stocking shelves, the people who are still in the fields picking the food that we're also dependent on, the high rate of African-American death from this disease, the lack of tests and lack of ventilators and lack of care, right? Where people are denied healthcare, basically being told they don't need to be in the hospital when they definitely need to be in the hospital. And so there's significant impact on communities of color. So I would love to hear a little bit from Rep. Sanchez and Rep. Meek and Rep. Alonso Leon and Lawrence-Spence about how you see the crisis impacting your communities, communities of color, as well as where you are. And I would love to start with Rep. Sanchez and then move to Rep. Meek.
Can you hear me yet?
Yes.
Okay, good. I won't change anything.
Wonderful.
Great. Well, thank you, Nancy. These are huge issues. I mean, obviously, Senator Manning touched on some things that have been, in my opinion, the most frightening things, is because we know that our communities are struggling oftentimes with just that whole healthcare issue, right? Sometimes a lack of access to healthcare, and then obviously, some issues that weren't normal to our communities prior to European engagement here in this country. I mean, we were healthy and strong people, but we've been put in a position where some of our traditional foods are no longer available to us. So we've been, we're given a diet of flour and grease and all of those things when people were put on the reservations. And so our health deteriorated quite a bit. And so we have a lot of really big issues, I think, in, overall with health issues. And that makes, if you look around the room then into a whole groups of Native peoples, you say, okay, who has a pre-existing condition that might, put them in jeopardy with this virus, and that's a lot of people. It's really amazing how scary that is, and for us, it's just again about what's the PC word, the socioeconomics of health, and all of those different things that are huge issues, and so we're looking to figure out how do we make sure that when our people do get sick, can they access the healthcare that they need? Sometimes they can, sometimes they can't, sometimes they don't feel like they can, even if they can, so those are huge issues. We're also, let me just say, I was on the phone earlier today with a bunch of the different tribes around the state, and they're having conversations, of course, with DHS and OHA and everyone else around this issue. One of the things that some of the tribes, I don't know that all of them did it necessarily, but some of the tribes actually immediately shut down their tribal nations, and they took that ability as a sovereign nation to shut their people in. I know other tribes across the country, basically they're turning people around. You can't come onto the reservation, which is amazing, because that's as they're doing their best to take care of their own people, knowing very well what a struggle that is to keep those people healthy and safe. We've experienced this before. We experienced smallpox. Right. That was intentional, right? And frightening for people. And we lost a lot of people to those types of diseases. And this is something that everybody is not immune to. No one's immune to this. So it is a frightening issue, but it's also something that we can take heart in that as a society and people, we have survived so very many horrifying things in our communities, and that we can continue to do that. We know we can be strong together. We can take care of our own. We can make sure that, so let me just say, Red Lodge Transition Services making the masks for everybody, right? Nice. And, a lot of our people are out there doing that because they know that, like, we have to figure out the ways that we can keep our communities strong and safe from this disease. And, it'll be an ongoing fight. I don't think it's going to get over anytime soon. I also wanted to just mention that, a lot of people said, well, we're just not testing enough. We don't know how bad it is. We don't know how bad it is here in the state of Oregon necessarily, because we're not able to do a whole lot of testing. But what we do know is that we do not have the surge in hospitals that a lot of other states do. We know that is not happening the way it is in other states. So maybe we did hit it in the right time. Maybe the governor did do an amazing job, which I think she did, of shutting this down early and getting us to a place where we will survive this much better than some other states.
I think so. Thank you for that. Representative Meek?
Hello, can everybody hear me now?
Yes, you sound wonderful. Okay,
thanks so much. And just to remind everybody, Mark Meek, State Representative from House District 40, Oregon City, Gladstone, he, him, and his. And, it's my honor to be here with everybody. And Senator Manning, sure miss you too, sir. Good to see you. I miss you all. And, but as you all of us leaders here in Oregon, we've been making calls to our community leaders and business owners and families. And that is, I think, what our communities are looking for, and for somebody that's going to work hard and understand the real issues and not, give them the true facts and the true story of what we need to do. And right now, the hunkering down, and I do appreciate the governor's leadership on this, and I think it was very important and decisive to get started. And I am, I'm on these update calls every day, Monday through Friday. I'm ready for Saturday and Sunday if we need them. But just to hear, where we're at, what our different agencies are doing, where we're at with our protective equipment, and all of those things are so relevant and very vital to protect our first responders out there. And one of the things I think, Nancy, I'm not sure if you had mentioned, I am a property manager. I'm an investment property owner. And, I'm working with my community, my, owners, my tenants. They're all, very thankful. I take, their lives, very seriously. And this model of being a small business owner as a, rental property owner takes, the human element into consideration. And if our tenants are affected by this, because they lost their jobs, and our neighbors really have lost their jobs, we have to, balance that with, with what our end goals are of, whether it's your retirement mechanism, your retirement instrument or whatever. But right now, it's very important that we protect our families, and that most people are, working families, working people are within, a paycheck or so of being homeless. And so that's very relevant during these, very, unproven times, untested times. And so I appreciate, I'm looking forward to potentially getting together with our legislature for a special session. There's a lot that the governor can do with executive orders, but there's some more minute details and different policy decisions we can make in this emergency to help, our communities and our governments survive and do more. And so I'm looking forward to that. And as always, it's my honor to, be a member of this very unique, class of leaders. And so thank you again for allowing me to be on your town hall.
Thank you, Representative Meek. And I wanted to switch it over to Representative Alonso Leon. You're in Woodburn, which of course is where so much of our food in Oregon comes from, and where there's such a strong farm worker community. And I'd love to hear how you've seen this crisis, how it's playing out in Woodburn.
Yeah, thank you for that question. While I'm really proud of the governor and all the decisions she's made, I think that it's also highlighted and elevated that we don't have an equitable system at the state level in respect to emergency and response. We have a large farm worker community in my district. We have a large, diverse community, non-English speaking community who speak multiple indigenous languages from Mexico. And so I have been working really hard to start, that I've started or drafted letter writing campaigns to make sure that not just the governor, but our leadership understand that, when you're thinking about emergency response, you need to be thinking about making sure that we have interpreters, translators who are going to translate that information quickly so that the non-English speaking community has the information that they need, and making sure that they are also following all of the policies and recommendations that the governor sends out. And making sure that our farm workers know how to take care of themselves as they are working hard in the fields and that they are essential workers, and that we should be providing them with state support that allow them to have access to healthcare and childcare and housing and so forth. There's definitely a lot of inequities that I've realized, and I've known this as a legislator of color, as the first immigrant in the country, in the state or whatever, at the Capitol, that there's a lot of work we need to do. And our farm workers who have spoken to me have said, our supervisors have told us we need to have, we need to work 6 feet away from each other, which is great. But at the same time, they're also telling me, we're required to wash our hands regularly. But think about this: if you are working outside in the fields and it is cold, right? It is so cold, but yet you're forced to wash your hands in the cold, because your only option is cold water out in the fields. And so, are we treating our farm workers with dignity in that respect? And I think about my mom. I get very emotional about this, because she and my dad are farm workers. And so would we be treating our parents the same way if they were all farm workers, right? So, I talk to my mom on the regular, because I want to hear what's going on in her life as a farm worker. And she shares with me, and I get, upset that we don't treat our farm workers better than we do right now. And so making sure that we are supporting them. And, we have the privilege, all of us who are here have the privilege of knowing we're going to have our produce in our grocery stores, but we don't think about how it got there. We don't think about the people who wake up early in the morning to late in the evening to ensure that food gets there. And so it's really important for me to elevate our farm workers, because we also know that we also have undocumented people in our state doing this work. And we know that many of them are not going to get funding through the federal government, despite the fact that they are contributing to our tax system and, improving our economic situation, nationwide. But yet there's thousands of folks who are not going to benefit from getting funding. So, this is, I think it's really elevated all the holes that we have in our state. And, I'm working really hard to ensure that we're not going to benefit. Their voices are heard, that they're being recognized. If a meeting hasn't started on a specific topic, I will start it in our state, because we need to have those conversations.
We do need to have those conversations. I do feel like, what you're saying is exactly right. I just feel like social inequities are really in the spotlight right now, because being able to socially isolate is a privilege. And even though it's hard, it is definitely a privilege. And I feel that when I know how hard it feels, and that it's actually really pretty easy compared to what people are going through and the insecurity that people are going through. I wanted to get Representative Lawrence-Spence a chance to speak. I'll share that last week we were on a call with Senator Jeff Merkley, and he was wanting to hear from the Basic Rights Oregon community. And one of our board members brought up, because the news had just come out of Michigan, that 14% of the African Americans are 14% of the population, but yet 40% of the COVID deaths, and wanting to make sure that our state is keeping that sort of data, and making sure that it's known, and that we're thinking about our communities of color and how this crisis is affecting them. So I'd love to hear you talk about how things have been going for you and your community.
Yeah, thank you so much, Nancy. And thank you to my colleagues who have brought up a lot of the issues that are, shared across communities of color. one of the things that Representative Sanchez brought up was the fact that, you know, for communities of color, for African Americans, for Native Americans, we know that we already have we are already overrepresented with the prevalence of pre-existing conditions, right? Heart disease, diabetes, hypertension, asthma, cancer, etc. Right? And these are the things that make a COVID-19 infection more severe and lead to higher fatalities. That compounded with the fact that a lot of people of color, African American people, live in low income communities where we know that their healthcare services and the quality of their institutions have been lacking for decades, right? We know that what this pandemic has done is really put in the forefront issues that needed action and needed legislative action and federal action for decades. We know that Black pain and discomfort is constantly and consistently minimized when you are talking to healthcare professionals. And we know that our institutions are underfunded, understaffed, and overworked. And at the same time, we know that African American workers are frontline workers, like the majority of people of color, right? Communities. They are the CNAs and the LPNs and the hospital cleaning staff and the sanitation workers and our grocery store workers and the people manning our childcare facilities right now so that people can continue to go and do these essential jobs. And so we know that they're not able to work from home. We know that even when they are trying to, that 67% of African American families in Oregon are renters. And right now, rent consumes almost 2/3 of a working family's income. And so in the city of Portland, we've talked about eviction and rent moratoriums, but what happens after the crisis, right? Are families gonna now be debt burdened because of the back rent when they already have trouble making rent payments on a regular basis? How do we help families climb out of this and come out of this without feeling more in debt and more burdened by the things that have consistently burdened their community for decades, right? Have halted and stunted their mobility, right? And stunted their ability to access the American dream. We also know that 75% of African American students in Oregon are eligible for free and reduced price lunch. And so school closures and the need for our school to continue to provide lunch on a daily basis means that a lot of our families are on or below the poverty line. And so food insecurity comes up, right? Because they rely on the school system to feed their children, to give them a balanced meal, right? And so when we think about all of these issues that compound and the fact that now we're asking students to participate in distance learning, but we already know that there's a limited access to internet, or that parents, 58% of Black households don't have a laptop, right? They are using internet on their phones. How can you provide and do schoolwork with your children on a cell phone? So for me, you know, what this crisis has done, yes, I'm proud of, you know, the Stay Home, Save Lives campaign. And I know that that is a very important measure for Oregon to not have that peak that so many states are going through right now, like my home state of New York, where I've had a friend 2 years older than me, 34 years old, pass away yesterday because although he is a business owner, he's a family man, a father of 3, he went to a hospital and was denied. He was told that he didn't need to get, sorry, I'm getting a little emotional. He was told that he did not need to be admitted. And they sent him home and he died. And so we know that, again, these issues that we already have in our communities, issues that we need to address and continuously advocate for, these are basic rights. The name of your organization is so apropos because these issues are compounded for communities of color and for the LGBTQIA community, right? Like to be somebody who doesn't fit the mold, right? To be somebody who is not Caucasian, to be somebody who the system has consistently told you that your pain doesn't matter, that your discomfort doesn't matter, that you don't get adequate funding, that it's okay for us to marginalize you economically. is okay for your community. And thinking about, as when I speak about that, I also think about our incarcerated and people who are under supervision, right? That they are Oregonians as well. And we have an opportunity to release people who are at an age where they are more vulnerable, they have pre-existing conditions, and we have an opportunity to release them back into community so they can fulfill the rest of their sentence under community supervision. We also have an opportunity to release the people who are supposed to be released for 2020 right now, so that we stave off the ability for COVID-19 to run rampant in these institutions. And so, yes, again, I agree with my colleagues that we have done a lot and that we probably won't get the kind of peak that has happened in Michigan and in New York and in in Illinois. But there's so much more that we can be doing. There's so much more preventative measures that we can be taking to fortify our communities, to prevent people from feeling like this is going to be 2008 all over again. That how are we going to pick up from this? You know, and so those are my concerns. And those are the things that we are, I think, collectively petitioning the governor and wanting a special session so that we can address those really granular issues that will make all the difference for Oregonians across the state, rural and urban.
Thank you, Representative Lawrence-Spence. And, you know, I think that a lot of us are probably feeling that there isn't an option to go back to normal, right? Because normal didn't really exist for a lot of people and it didn't work, right? Normal is causing the situation we're in and the inequities were that are just so at the surface right now. So I really appreciate your comments. And I just want to say for folks who are watching YouTube right now that the way to ask your questions is in comments. So write your question in the comments and I will ask them on your behalf. And we have a staff person whose only job is to look at those questions and make sure that they get to me. So
Nancy?
I have a first question actually that's come up for whoever wants to join in. So several folks, including me, have commented on the need for racialized data during this crisis. What do we know about if the state is collecting data on the race and ethnicity of COVID patients in Oregon?
I'll fill that one just because I just started, but I looked at the OHA website today, and from what I can see, they're not capturing racial demographic data. They're capturing gender data. They're capturing county by cases by county. I think Rep Nosse is going to chime in on that. So I'd love for you to say if you have any more information as to if OHA is pulling that data, but we just aren't, it's not public yet.
It's not public yet, but I do think the plan is to make that available. So that was, I believe that was discussed on one of the phone calls that we're all on constantly. And that is something that's in the works very soon. The health authorities trying to figure out how to capture that.
Great.
They know that's a weakness in the data that they're putting out there, and their plan is to try to improve that.
Yeah, Nancy, can you hear me?
Yes, go ahead, Rep Meek.
Okay, I don't know if this is private information, Representative Nosse, but it was mentioned today on the call that they are capturing some of that data and that the Latino community are basically have a higher rate of incidences than any other demographics in our state. And to me, it goes right along with Representative Alonso Leon was saying, we're not doing enough to protect our workers out there that are being housed together and working together, don't have good conditions in which to care for themselves and keep themselves clean, and even to properly distance themselves. This is a travesty that I think needs to be addressed, and I think we missed the mark on this. And I was very frustrated. It doesn't need to be private. We need to make this known and quit screwing around. Make sure we know how to protect our families out there. So sorry if I'm a little upset about this, but that is not supposed to be a state secret. This is public information, and we're paying public dollars for this data to be contracted. Let's help people and save lives, all of our lives.
It makes sense to be passionate about it. It is very upsetting And yeah, it all makes sense. You never have to apologize for having feelings when you're with Basic Rights Oregon. And we have a specific question for Representative Power. We have seen several comments about profiling and discrimination only being exacerbated by this crisis. We've seen an uptick in hate crimes and discrimination since 2016. Given your work on the Hate Crimes Task Force, what's the state doing to address hate crimes and discrimination? And of course, we've seen especially an uptick in anti-hate crimes during this time.
Yeah, the normalizing of language being used around this and the way that it has manifested in really extreme ways in bias and hate crime attacks against our Asian American and Pacific Islander populations is atrocious. You know, remember, thanks to Bro's advocacy work and a number of other coalitions, we strengthened our hate crime laws in 2019, led by the Attorney General's Hate Crimes Task Force. That new reporting process is still in place. And I wanted to highlight for those of you who don't follow national or our state work as closely as others, within the last year, we've now added gender identity to the list of protected classes. Somebody's gender-related identity, appearance, expression, or behavior. So that is a broader category now of individuals. We had sexual orientation in there now. With gender identity, bias and hate crime incidences can be reported and prosecuted differently. The Attorney General's office led a sign-on letter denouncing the bias and discriminatory language coming out of a number of different federal sectors. And so I think many of us on this call signed on to that letter to denounce it. And individuals and others can still sign on. I wanted to give you the URL if you want to go visit it. It's www.standagainsthate.oregon.gov, where you can sign on to the pledge. And the coalition of signers and others have been working to promote patronizing businesses of people who have been are members of communities that have been discriminated against to help them get through these times. And Oregon has been at the forefront of enacting stronger protections for a number of different communities. Hate has no place here in our communities. And our laws have not been suspended amid this crisis. And so I want to remind everyone else, you are afforded the full protection of our laws.
Thank you, Representative Power. While we're waiting for the next question, I would want to talk a little bit about, our next question is here. Okay, this one is specifically asking for either Senator Manning or Representative Lawrence-Spence to chime in. That, now that people are being asked to wear masks in public, there's a question being concerned about the impact of asking the general population to wear masks with the history of Black and Brown communities of being criminalized for wearing a mask, and that it would be a safety risk, especially I've heard for Black and Brown men in particular to be wearing a mask, that they would be seen in a certain way. Could either of you speak to this concern?
Yes, I'll jump in first, and then Rep. Lawrence-Spence can follow up. Today, on one of my news feeds, there was a report of a African-American man that was shopping at one of the, I think it was a Walmart store, that had a face mask on, and he was escorted out. He was escorted out because he had on the face shield or the face cover. Uh, my experience growing up, I grew up in St. Louis. I remember my first encounter with law enforcement. I was left a friend's house and I was going to cross the street. Now we're in the middle of a block, and I noticed that this police car had pulled down and he stopped. So I was with a friend of mine. So I decided that, well, I'll go to the corner, cross over at the light because I didn't want to get a jaywalking ticket. When I did walk, he did, my friend crossed in the middle of, where we were, where he lived, and called me down. The first experience I had with this, that encounter, the first thing the officer asked me was, where was the hammer? And I said, hammer? What hammer? The hammer you were using to break into parking meters. We didn't have a hammer. We had just left this house, going to my house. So that is real. Now, some may say that it doesn't happen. I have to be perfectly honest with you. I'm guarded, oh my God, each and every day I go out. They don't know, every officer don't know me. I know a lot of officers. I support law enforcement. I am for law enforcement. I have a career, a background in that. But I do also understand that if you don't get the right quality of person in order to wear that uniform, then you set yourself up for failure. Now, at another venue, we can go across and talk about a lot of things that I know and I've experienced as a Black man in America dealing with law enforcement. I can give you the good, the bad, and the ugly. But we're in a spot now where we, through the CDC, is suggesting or recommending or saying, alluding to, if you're out, then face protection or face covers can be a deterrent. It's not totally guaranteed, but it can be. How many others people that can walk that are not people of color and don't have to, go through this process or be the end of that? So it is really scary. And, again, we're in new territory. Generally, in the past, throughout my law enforcement career, if someone came in with face cover, probably they were up to no good. Now we're saying that it's a good thing or it will help in terms of being a preventative cause of spreading the disease if you're asymptomatic. We now know that the majority of people of color, especially when you get to some of the metropolitan areas, St. Louis, Chicago, I don't even know what the numbers are like in New York, because of the communal type of transportation. People are riding public transportation, and the virus is running rampant. Loss of life, and particularly when you start breaking down the numbers, Chicago did it, 70%. That is astronomical. So even though you try to protect yourself, according to the CDC, do you still put yourself in jeopardy? That is a real issue. It's real, it's happening now. And I'm concerned about that.
Thank you, Senator Manning. Representative Lawrence-Spence, would you like to chime in?
Yeah, one of the bills that was introduced last session, House Bill 4126, was about wearing masks for riots, right? Or using masks to criminalize somebody in a riot, right? Which, was really about people protecting themselves against law enforcement when you're at a protest and they consistently utilize pepper spray and things like that, right? So you're using it to protect yourself. So it's essentially the same thing, right? and people of color, the ACLU, so many other organizations came and testified against this bill because we know who would be criminalized when wearing masks to fight for their rights, right? And this right now is a fight for your life. And you're criminalizing people who are already pre-exposed to pre-existing conditions and who already need to be able to protect themselves, take every measure to protect themselves in the public sphere when going grocery shopping or when transporting themselves from work to school or dropping a child off at daycare, because again, you're more than likely an essential worker who has to still go to work during this time. And so, it's more than a valid concern. It's something that we are constantly trying to protect communities of color and African Americans against, this need to over-criminalize actions that are innocent or actions that are made to protect yourself, right? So for me, like Senator Manning said, it's one of these things where it's a valid concern, but what do we do? How do we help to keep people of color safe? How do we help to keep the African American community safe in this time? And again, it's creating orders from the governor's office or talking about it, right? Holding law enforcement accountable so that we don't have a situation where we are talking about a COVID-related death that is not due to the virus, but due to somebody assuming that you are trying to evade police, or that you are trying to do something else or seen as criminal, right? Because that's what happens in our communities. So it's up to us to, again, do this from the top down, right? It has to come from the tops of these institutions. It's not going to be enough to have the cop that is on the beats, make this a rule. It has to come from the people in power, because all too often we ask the people who are doing entry-level jobs and the entry-level work to be responsible to communities when it's the people who are at the top of these organizations.
Thank you for that. We have a question for Representative Nosse. Your other job for many years was working for the Oregon Nurses Association. And we know we're hearing all over about the need for personal protective equipment for medical professionals. And I don't know if you've heard about the needs of our nurses here in Oregon and if there's things people can do to help meet those needs.
So this is unfortunately a very frustrating situation that we find ourselves in right now. And I'm just going to say that I think the blame for what we're experiencing with the lack of the protective equipment that not just nurses, but all sorts of healthcare workers and frankly, bus drivers and grocery store workers need is, I think the blame can clearly be laid on the Trump administration. They have the authority, I'm going to goof up the terminology, but basically to declare that we're in a war and demand that manufacturers produce these things. And this is still a very rich country that's very capable of making the things that people in all sorts of jobs need to have for their safety. And all I can say is that the governor and her staff are spending way too much time trying to figure out how to get the things that healthcare professionals and frontline workers really need. And they are just as frustrated as everybody else is about how difficult it's been to get the necessary equipment. And there are a lot of high-level people working on this. They are contacting manufacturers all across the world, not just in our country. But we continue to have a kind of problem where states acquire the ability to get some personal protective equipment, and then they find out from the manufacturer that a different state has offered to pay more to have that equipment. And so then we find our governors sort of pitted against each other by this situation. So candidly, I'm hopeful that eventually the Trump administration will sort of federalize this and demand that equipment be made so that we get out of the situation. It's ridiculous.
Yeah. Thank you for that. So what I want to remind folks about who are listening is that we still want more questions. We still have more time, but you all are doing a great job and asking great questions. So right now, we actually just got a question about gender affirming care and what's happening right now. And so Bro did a survey asking our community how they're doing, and 10% said either they or their spouse are not getting gender affirming care right now that they've been planning on getting because of the COVID-19 crisis. And we know that people wait oftentimes years, sometimes a lifetime, to have the surgery, to have the care that they wanted or needed. And I will, if anybody wants to weigh in on this, you're welcome to, but I will also say that next week, our Queer Town Hall will be focused on trans health and trans health care and what's happening right now. So we'll be sharing a ton of information about from healthcare providers about what people can expect. Obviously, nobody wants to be in hospitals right now because they're really dangerous places with the COVID-19 crisis, but also we also know that the lack of gender affirming care really affects people's mental, physical health. And so it's definitely an issue that we are well aware of and are have been trying to think about how we can best address this from a policy level. But I'd love to hear if anyone else wants to weigh in on this.
You know, Nancy, I really actually be very interested in joining that conversation if it's available for policymakers to sit in on, because this is actually a really big problem. There's lots of people that have, quote, I don't know, elective surgery is not the right word, but surgeries that have been put off because both they're trying to save capacity, try to not have people be in the hospital, to your point, and it's a real struggle. Hopefully, we get through whatever our peak is going to be, and it's not as bad because of the measures that we've taken, and we can get back to getting people scheduled in. If you live in the metro area, we're lucky that we have OHSU. And hopefully there'll be some folks from OHSU as part of your town hall, because they have such a great center, and the work that they're doing for gender affirming health is really quite wonderful. We're lucky to have that resource in our state.
Great. Thank you, and you're invited.
Okay. Hope I can come.
Rep Power, did you have something?
Yeah, I wanted to add, I'll look forward to tuning in. I don't need to be on it, but Rep Nosse being on our healthcare committee, I think is on point. I think many of our providers were beginning to cancel procedures prior to any kind of executive order because they first and foremost place their patients' safety at the center of what they do. This has been compounded by shortages of PPE, but bringing people together in healthcare settings right now is
risky,
not the safest place for many people to be. And so when it comes down to having to make those tough decisions to delay essential care, many of them are doing so and had planned to do so irrespective of a government directive, because it's the safest thing for you to be going through right now. And I know that's incredibly tough, especially because of so much leading up to these kinds of procedures. But I trust our providers to be making the best healthcare decisions for their patients. And once we come out on the end of this, they'll be there, ready to deploy services again.
Great. Thank you for that. So I think it's come up, and Representative Meek, you mentioned it, but the crisis has really brought up a few things, including lack of well, what used to be a lack of tenant protections, but and paid family and sick leave. And then, but in 2019, the legislature passed some great tenant protections and paid family leave. Representative Meek, would you like to weigh in on those bills?
Yes, yeah, thank you so much. And it's interesting you brought this up because our industry, I help people buy and sell homes too. Can you hear me?
Yeah.
Okay. And they're currently, I heard about a tenant that was being asked to show their unit, their house that they are renting to potential buyers during this, stay safe and stay healthy policy. And my response to them was, you have all the rights to that property and you have all the rights to your safety and health. You do not have to show your home. You do not have to obey that 24-hour notice, because even at the bottom of the notice, it says, if I can't, if this is not good for you, then, just let the property manager or the owner or whoever had provided the notice. But the good news is also that that Senate Bill 608 did a lot to protect families to know that they cannot be given a notice to move because of the landlord or the owner doesn't like them or doesn't feel that they're the right type of people for their community. So those protections were very important. And I think as we move into this, response that to keep people housed is more important. And I think it's very valuable. I heard a discussion earlier today about a property manager sending a notice to their tenants saying that if you receive any money from the federal response, that you need to use that as your rent. And that's just not true. And the point is that the executive order basically made it illegal or unlawful to proceed with any eviction notices. So that's the first point. What's going on right now, unfortunately, there's not a lot of guidance as into how the tenant will be responsible for any missed payments in the future. And like Representative Lawrence-Spence had said, just because I don't get paid, I'm not working for 2 months, I'm not able to pay my rent, and suddenly I'm back to work, and now I owe 3 months of rent. How am I going to afford that? How am I? That doesn't add up. It wouldn't even add up for me if I missed my mortgage payment for 3 months and then suddenly I had to make all 4 payments at once. It's just impossible. So my hope was that, and Representative Nosse, you hit it on the head. We need real true leadership right now at the federal level. Our administration could have gone to the banks. The banks got bailed out in 2008. I survived that. It was really tough, but I saw them, really get out very in very good shape, put it that way, after the, irresponsible activities that they engaged in. What we need to see is we could have a rent freeze, but we can also have a mortgage freeze where, the admin says, not just Freddie Mac and Fannie Mae, you don't have to ask for it. Guess what? Time out. We're done. We have to protect each other right now. Hey, banks, okay, they don't make a payment. That goes towards if they have 300 payments left, now they have 301. Now they have 302. Now they have 303. No late penalties, no fees, no attorney's fees, and no late notices or no reporting to the your credit agencies. So that way the tenants could stay home and could be safe. And the folks that own these properties would know, okay, I can still pay my payroll for the managers, and I'm not going to lose my property also in a foreclosure. So we're in a war. Representative Nosse had mentioned, and we're fending for ourselves. To me, it's like if we were in a real battle, a real war where we needed guns and bullets, and that each state had their own militia, and by golly, go out and get your own guns, and we're going to sell them to the highest bidder. and then we're going to see what state wins. That's not how this works. We're united, the United States of America, and we got to work together. And that's what our federal government's all about, uniting us and helping us. So we're going to do what we can do here in Oregon to help our tenants, but absent that federal, work, where we're kind of limited.
Thank you, Representative Meek. We are running low on time, but we do have a last question before I let you all make some closing remarks, and then we shift into talking about the census. As we all know, because we see it all around us, the unemployment rate is skyrocketing right now, and businesses are closing. Many LGBTQ community is overrepresented in the service industry, and a lot of people have lost work. Representative Sanchez, would you speak to what the state's done to expand unemployment benefits and what can be done to support women and minority-owned businesses at this time?
Oh, goodness, I hope so. Well, obviously we're, the system is currently overwhelmed. They are literally processing more applications in a week than they would in a year. So that's an outrageous situation that we're in. They are working to bring new people on to be able to continue to process those applications, asking people to fill out the application online and wait for the call back, not to sit on the phone, because that doesn't make a whole lot of sense. People are not getting through that way. It's just clogging up the system and causing people to have to be frustrated and upset about that. We know that there are, of course, the small business, hopefully grants more so than loans, but some low or zero interest loans coming down to make sure that people can access ways to save businesses. There probably will not be enough for everyone. Let's just be realistic. We want people to do the best they can to continue to employ people and be able to have that ability to get those grants to pay themselves back for that. It's not going to be an easy time for anybody. I'm just, I want to be realistic. I think that's so very important to just pay attention to that piece and say, we're going to have some hard times going forward, but there is somewhat of a safety net. Oregon is trying to make sure that we can see what the federal government's going to put forward first before we put that huge investment in from the state side. So hopefully we can fill any of the gaps, the holes that will be there. We probably won't be able to fill them all. And we're going to struggle for a minute, but we're going to struggle as a state and as communities together to try to make this get back to normal at some point. I'm doing the best I can to have Chinese every opportunity I get.
That's great. Delivery is important. Representative Lawrence-Spence, would you like to give some additional thoughts? And then I'm going to shift us to closing comments.
Yeah, I think Rep. Sanchez did a great job at saying that there is a great need and there's not enough money from the feds or probably not even on the state side. But the move right now is to try to see what the federal money will be able to do and ensure that we're able to fill in the gaps. One of the things that we're all concerned about is having the communities that tend to shoulder that burden, the lack, that we don't shoulder that burden in this instance, right? That we're not left behind, that we're not bailing out larger companies who will be able to shelter through this storm, and that we are making concerted effort to bolster and to fortify those businesses that have no other route, right? And that we're giving them the types of money that they can actually utilize and not make them debt burdened. So I think that we really are trying to be judicious in how money is allocated and to, again, ensure that the need is met and the communities who are used to being asked to do with crumbs, that they actually get the lion's share.
Thank you for that. Yeah, there was also an exciting chat conversation about those small business loans, and there not being enough money, which of course, as a small nonprofit, actually Basic Rights Oregon is applying without a lot of hope, but hoping that we're able to, keep our staff during this hard time. It is a hard time for everybody, and I think we're all doing the best we can and fighting for our communities. I would love this. I just feel like we have so much to talk about, and I'd love to keep talking to all of you. But I'm just going to give everybody like a quick 30 seconds. Any final thoughts you'd like to share before we move on to talking about the census? And I feel like I'm going to maybe do this alphabetically or try. And I'll go.
Last name, Nancy.
I'm gonna try. I feel like I know the alphabet. I've been singing the song a lot while washing hands with my kindergartner. So let's start with Representative Alonso Leon.
Thank you, Nancy. I think just some thoughts for everybody. Just continue to stay home. I think that's really going to be the game changer for our state, and preventing more people getting sick, and understanding that if you are sick, to please go to urgent care, please call and get tested. And I think what's really important is just to remind folks, like, if you're not able to access, you have your legislators who can advocate for you. So let us know when you're struggling so that we can then step in and advocate and do what we need to do to ensure that you get the attention you deserve. So, wash your hands regularly, stay home, be creative and the activities that you do at home. But really, just stay home. That's all I can say. It's going to take care of all of us.
Thank you. Representative Lawrence-Spence.
Thank you, Nancy. I'd like to reiterate some of Representative Alonso Leon's statements and saying it truly is the best thing that we can do right now is to stay home, because it really is the way that we flatten this curve and we protect our communities. And, one of the things that I think about a lot is, our mental health is being strained and tested right now. And the good thing is that we, unlike some pandemics of yesteryear, we have technology that is able to connect us. And just like you can do a Zoom conference for a town hall, we can do Zoom conferences to check in with friends and loved ones and to ensure that they are staying healthy and to hold each other accountable for staying home, and to hold each other accountable for being a steward, a true community steward. Another thing that a lot of my constituents have been asking about is feeling like, staying home is putting you in a position where you're not doing anything, where you're not helping your community, and they're wanting to give back. And there are a lot of nonprofits who, like the food bank or Blanchette House in my district and things like that, who are doing a lot of phenomenal work to feed our houseless neighbors and to give them the protective equipment like hand sanitizer and giving them hand washing stations and things like that. And we can, without leaving your home, you can donate money. You can, when you go to the grocer, you can pick up extra canned goods and people will pick them up. So I think that there has been a great spirit of mutual aid happening in our communities, and we're seeing the strength of community in Oregon and in POC communities, because we're so used to relying on each other and sharing resources that we've been doing that so long, and we're doing that now in the time of crisis, and to continue to do that. And that's part of how we soldier through this crisis and how we continue to take care of each other. So, and thank you so much again to the nonprofits like Basic Rights Oregon who put these panels together and keep us connected to our people, right, during this time, and to let them see us and see that we're working for them. So I'm very grateful for this platform.
Thank you. Senator Manning.
Okay, Nancy, first off, let me thank you and Pro for this opportunity. This is really fantastic. I want to thank again my legislative colleagues for their time, their wisdom, it's always learning for me every time I talk to either one of them individually or collectively. I learn something from them. One of the things I take away is that they actually care. This is the real, they are the real deal. And that's what makes Oregon so unique. Earlier today, we were talking about the calls, the daily updates we get. One of the things that kind of perked my ears was that when they were talking about purchasing hand sanitizers from an outside source, we have distillers here in the state, in my district, that stood up early on to make hand sanitizers and deliver them at no charge. I want to make sure that when we're spending money for out of state, we need to look in state first. We need to make sure that we're supporting small businesses because that is the lifeblood. Those distillers that shut down their operations to make hand sanitizers and to just donate them, we need to make sure that we're purchasing from them first. So one of the things I'll be looking at, as a member of Ways and Means and the E-Board, is that if we haven't done that, why haven't we? If we're going to kickstart this economy, it starts locally. And that's where we need to start investing our dollars.
Thank you. I'll move to Representative Meek.
Thank you, Nancy. And I'll keep this short. I've had a lot of airtime here tonight. But I do want to just let everybody know one thing I recommend is make sure you take care of yourself during these times. Make sure you love yourself. Get outside, get some fresh air, call your mother, call your other mother, call your parents, and read a good book. And remember, all this tragedy is going to be there, but if you're not there, then it doesn't matter. So we all need to love each other during these times. And I think through that process, we will get through this. So thanks so much for Basic Rights and Nancy for having me. Okay.
Thank you for that. Representative Nosse?
So I think jumping off what Representative Meek just shared, I'll say a lot of your viewers know that when I'm not doing this, I'm a union organizer. And I'll just say that the importance of solidarity and coming together through Basic Rights Oregon and our community and other queer-based organizations in our state is really critical right now. And I appreciate the work that you're doing and that other advocates around the state are doing to hold all of us accountable to try to do the best that we can, because it's going to get, we're going to get through this, but in the short run, we're going to experience a lot of difficulty with our state's budget and other resources, and we're going to really need to pull together to have our state come out of this in a way that we all want to love and recognize.
Great, thank you so much. Representative Power.
Rep Meek did a great job, I think, of teeing off to conclude. I wanted to add that I have a 3 3/4-year-old, and I'm watching how this is coming home for him in the way that our kids are really struggling through this. So wherever you are individually on adjusting to life in a pandemic is fine. If you're in pajamas today and you haven't gotten dressed, don't get mad at yourself. I mean, we're all doing the very best that we can. I'm sure I'm not the only one on this panel who is having COVID insomnia in the middle of the night and trouble sleeping. Oh. That is normal. It's terrible. I feel like we should start a Twitter thread. Like just last week, I found myself crying on my kitchen floor because my son was having a really hard time and I was right there with him for it. So we're not going to come out of this normal. It is exposing giant cracks in our economic system that have always been there, but have been papered over through living paycheck to paycheck. And we have a federal administration that really doesn't care about regular people, and a Congress that's been fighting for policies that do the best they can. And we're seeing shortfalls and gaps in what has already been passed. And we're limited here at our state level in what we can do with the way that our budget system is set up. So this is going to be a longer process together. and we are all going to be working on your behalf. But, if you are coming to a place where you are emotionally ready to engage a little bit more in public policy, pay attention to elections. What happened today in Wisconsin was abominable. I had a friend from law school doing election protection work, and we are fortunate to have vote by mail here in Oregon.
We sure are.
But we need to pay the heck attention to what's going on nationally, because the Supreme Court decision barring people from being able to use absentee ballots is voter suppression. And it'll be up to all of us raising our collective voices to not accept that in any of our fellow states, and fight for a better outcome in November. So thanks.
Great, thank you. And closing us out, Representative Sanchez, parting words.
Oh my goodness, there is so much that I would like to talk about with everyone, and just to realize that we are in a place that no one has ever been in, who wasn't maybe an infant when it was happening back in 1918, right? We are in a place that people are going to struggle with trauma. They're going to struggle with so many things that are just unnameable for a lot of people. And I really just want to encourage people to pay attention to the way you're feeling, connect with family and community, whoever you can. If you're struggling with addiction, there are people to reach out to. I want people to really recognize that you are not alone. No one is alone in this. And you hear all the messages, we'll get through this together, but that really is the only way. It really is the only way at this moment in time, is that you connect with other people and not isolate yourself and not give in to the fear. Because it is a scary moment in time, but we're here and we're going to do whatever we can to make it the best possible outcome. And you've heard all of these people talk about all of the different things that are such huge issues and such big fights for all of us. We have to change the way this system came down, right? I mean, we are so much more clear, even at this moment in time, the inequities between the rich and the poor, and the haves and the have-nots. I want to see whose house has all the damn toilet paper, right? And all the poor people who couldn't get toilet paper because they could only afford to buy it one pack at a time. Like this, even that little microcosm of a process explains where we are now, that poor people are not going to be able to buy those types of things and save their own lives, that we are relying on food bank right now and the delivery that other people are making. This is a different world, but you're not alone in that world. Just remember that over and over again. Please remember, you're not alone in that world. We're here. And, just want to, again, thank Grow for making this opportunity available to all of us to speak out and say the few things that we can for this short period of time.
Mm-hmm.
Thanks.
Thank you all. I really appreciate your time, and we are not alone. And I will try to segue into the next part of our town hall, which is really talking about the census. And you all are welcome to stay on, but we have an amazing professor, Jason Jurjevich, who was at Portland State University and moved to Arizona. He left us, but he still has all his wisdom about the census and specifically the LGBTQ census and how our community has been counted and not counted for decades. And so we are going to shift this town hall into talking about how our community can be counted. I think the last thing I saw was 40% of Oregonians have submitted their census forms, and I know we can do a lot better than that. So I'm going to ask Jason to share some information with us. And thank you all for being part of this town hall.
Thanks, Nancy. Hello, Oregon. It's great I want to thank Basic Rights Oregon, the Queer Resource Center, and Nancy in particular for inviting me here today. A little bit of background. From 2010 to 2019, I was the director of the Population Research Center at Portland State, and was an associate professor at Portland State, and was also part of Governor Brown's Complete Count Committee. In November of 2019, I left and I moved to Tucson. I'm now at the University of Arizona in Tucson. So even though I'm no longer in Oregon, I appreciate seeing you all here, and I want to talk with you a little bit today about census overall, and then particularly census and the intersection between the LGBTQ community. So I'm going to share my screen, and hopefully you can see the PowerPoint. Are we all good? Okay. So a little bit of background. When I was director of the Population Research Center in early 2018, I was getting calls from across Oregon, many Oregonians who were concerned about the decennial census coming up in 2020. We're aware of some of the challenges and obstacles that were emerging that were potentially going to lead to challenges to a fair and accurate count. And so I created this website when I was at Portland State, which basically provides a lot of information about Census 2020, more information that I'm going to discuss here, because I really want this to be a conversation and try to address any questions you have in terms of the work that that Oregon's doing and that I was involved in, as well as the census more nationally. So one of the things I think to think about is that one of the metrics of success of any census is the percentage of the households that end up self-responding. And this is a graphic that I had put together for Governor Brown's Complete Count Committee, because ultimately one of the barometers of success in Oregon was comparing how we're going to do in 2020 relative to how Oregon did in 2010. So roughly 80% of households responded to the census in 2010, which ranked Oregon slightly below the median for the U.S. Oregon was ranked 28th. See, I'm so used to saying we because I have been there for 10 years. The importance of this statistic really is that the resources required at the federal level and at the state level to follow up with that 20% of folks, which we call hard to count populations, is a really important benchmark at the state level as well at the federal level. So the good news, and Nancy alluded to this, is that our response rate as of April 6th nationally is 46% of households. And I'm delighted to say that Oregon is currently number 16 with 47.8% of households responding. So early numbers look good for the state in terms of the response rates. And I think, that really speaks to the work that has been done at the governor's office, complete count committees across the state, as well as the We Count Oregon campaign, which has also been a great partner in the work that's virtually in all corners of the state. So in a time when we really could use some good news, this is definitely good news for the state of Oregon. I also want to mention too, the U.S. Census Bureau has response rates down to the census tract, which is a place you can go to. Although I prefer this website at the University of New York. It's called HTC 2020. And you can drill down to census tracts. I decided to pick Cully, which is highlighted here, census tract 75. The response rate in Cully is higher than the state average at 50%. And you can see that the yellow colors and orange colors indicate lower response rates. So areas downtown, Old Town, this is the PSU census tract, parts of inner southeast, the industrial southeast, east of towards Laurelhurst, and then the highest response rates in the Grant neighborhood, Irvington, up towards Alameda. And then you certainly see it's kind of hidden here, but lower tracts in East Portland and eastern Multnomah County. This is available for the entire state. So if folks want to sort of get a sense of where they are, how their tract is doing, I would encourage people to take a look at that. So with respect to LGBTQ plus populations, the Census Bureau does not ask individuals about their sexual orientation or gender identity. I'm sure, if I was in a room with you all, I would ask how many of you filled out your census form. It looks like a lot of you have, which is great. But you'll know that sex is asked and gender identity is not, and there's no questions about sexual orientation. And I'll give you a little bit of a backstory on that. The problem is that census data are often used as a proxy for the LGBTQ community. And there's really, one of the reasons for that is that the census is an enumeration of the population, and it's done once every 10 years. There's no other enumeration that we have in the United States. If you don't rely on an enumeration through the census, you have to rely on statistical samples, which tend to be obviously small. They're a statistical sample, they're not an enumeration, and the sample sizes can be relatively small, which means it's hard to draw any meaningful inferences. Cross-tabulated populations, so if you wanted to do people who identify as gay, who are folks of color, who are between the ages of 30 and 50, right, that you can't really, because of the reliability of the data, you can't do that. So but one of the things that has shifted is that this is a map of LGBT population in terms of total numbers by the Movement Advancement Project. In the past, a lot of these data were using census. A lot of these sources were using census data, in particular, the number of same-sex coupled households, to make inferences about the LGBT population. This is actually using data from a Gallup. I don't know where it is here. Yeah, Gallup data. So using a poll from Gallup, and then using census estimates of population to derive numbers for the population. And again, there's limitations in this approach, just like there's limitations in using same-sex coupled households. The point being that absent a question on gender identity or sexual orientation, if we're not asked about our community, these are the data that people are using, which has numerous limitations. So the backstory in terms of the same-sex coupled households goes back to the 1990 census. In 1990, the Census Bureau decided to add a category to the household relationship question. So anytime you have more than one person in a household, the Census Bureau wants to know, how is person 2 related to person 1? And so in 1990, they added a question, or an option, I should say, called unmarried partner. And the backstory on this is quite interesting, but they ended up, to their surprise, getting a lot of same-sex partnered households that checked unmarried partner. And this was the option that existed for the 2000 census, as well as the 2010 census. And so sometimes if you see census data mapped for same-sex partnered households, this is the origin of where those data are coming from. In 2020, we have the first decennial census to ask about same-sex married spouses. So you'll see, if you filled out your form, you had this being the 4 options, that, well, I should say these being the 2 options that are different from the previous versions. These 2 options for same-sex spouses, same-sex unmarried partner having been the option in the past, same-sex husband and wife spouse being the option this time. So this is the first enumeration we will have following marriage equality for the first census to enumerate populations. So one of the things that I want to make you aware of, and I know this is a lot of text, is the Census Bureau releases a report on questions that they ask in the decennial census, as well as their American Community Survey. And the American Community Survey is simply, it's an annual survey that the Census Bureau puts out every single year. It actually runs continuously, month by month. And they ask households, roughly 1 in 40 households across the United States, questions about poverty, income, educational attainment, commuting, right? So all these data that we need for public policy decisions. And you'll see here in March of 2017, which is down here, sexual orientation and gender identity were a proposed topic. After that was released, about 3 days later, the Bureau released a revised list of topics, and you can see that sexual orientation and gender identity is now not listed. The backstory on that is that with the proposed citizenship question, which I presume many of you are familiar with, the proposed citizenship question on the decennial form was challenged in court and in federal court, and various people were deposed in that court proceeding. And one of the individuals that was deposed that NPR, particularly their census reporter, Hansi Lo Wong, had reported on was a gentleman by the name of Earl Comstock, who's the Commerce Department head of Office of Policy and Strategic Planning. And he basically, in his deposition, admitted that the current administration, the Trump administration, wasn't interested in asking about sexual orientation or gender identity. And what came out of this was that the reason it was added, that the Census Bureau had added it in March, was that under the Obama administration, the Justice Department and 3 other federal agencies, which include HUD, EPA, and Centers for Medicaid and Medicare, had requested the Census Bureau explore gender identity and sexual orientation to be added in the future to the American Community Survey and the decennial census. So this really was a repercussion, an outcome of the current administration deciding to withdraw that proposal and remove it from the list of planned subjects. There has been some movement in Congress in the wake of this, which I think we all should sort of keep track of, which is the LGBTQ Data Inclusion Act, which was sponsored by actually a representative here in Arizona, Raul Grijalva, and Senator Tammy Baldwin from the state of Wisconsin. It's been introduced, I believe, twice, and it was most recently introduced in 2019. And it would essentially add sexual orientation and gender identity to the American Community Survey and to future decennial censuses. So I just think this is my last slide, and I'm happy to address any other questions you might have, but this is just, I think this is a representation of how long this fight has been going on. This is actually a sticker that the Gay and Lesbian Task Force sent out in 2010, asking respondents, at that time we could only do it by mail, so there was no internet response, to put this on the back of the envelope to send a voice to the Census Bureau and the federal government to add questions around sexual orientation and gender identity. So this is something that has been, discussed for, longer than 2010. It's been discussed for the past 2 decades at least, if not more. And it's something that, although one step forward is obviously having marriage equality with respect to same-sex married partners being enumerated on the census, orientation and gender identity are not questions that are currently asked.
Thank you so much, Jason. Yep. And the way I met Jason was because we were at a complete count meeting, and I was asking about, what about non-binary people? What about the trans community? And there were census officials, and they were like, yeah, no. And Jason had a much better response because, of course, this is something he's been looking at for a long time. And I just want to say, in Oregon, we have 4,200 people with an X on their driver's license who identify as non-binary. We know we have thousands more, right, who don't have the driver's license yet. I think that there's a lot of folks who don't fit into the M or F. And I think our message here is we want you to be counted. We need you to be counted. And I'll share a really personal story, which is in my household, my partner identifies as non-binary. And it was really painful for them to mark F, right? And that's not what's on their driver's license. That's not what's on their passport. But my argument was, at least we'll be counted as queer. And so I feel like, people are making painful choices in order to be counted, and we shouldn't have to. And I think folks like Jason and the Complete Count Committee and people, the LGBTQ people who work on policy and who are academics, are, fighting for all of us to be counted. And I think it's so important that all of us, LGBTQ community in Oregon, be counted. And I'm being told that we don't have time for questions because we have to end right at 8. But I wanted to give you a chance for any final words, Jason.
I just think this is going to be something that you know, the fight is going to continue. And you know, a personal sort of quick story for me is that my husband was active duty military, and under Don't Ask, Don't Tell, obviously those are very difficult times. And prior to marriage equality, you know, when Don't Ask, Don't Tell was repealed, we finally got an opportunity to stand up and, you know, say that, you know, we were a committed couple and we didn't have the fear of him losing his job in the military. And so, you know, obviously there is pain still in terms of not having the questions that need to be on the form to represent the diversity and of our full community. But we all need to, you know, keep fighting for it. And if people have particular questions that they want to ask, feel free to email me, and I will be happy to address anything that we couldn't discuss here.
Thank you so much. And also just want to share with folks that if you mark something that's different that what's on your driver's license, no one's checking. So, you know, feel safe. No one's going to come to your house and ask you about it. I just want to give a big shout out and thank you to all the representatives and senators who joined us tonight, for Professor Georgievich, and for all of you for tuning in. And every Tuesday night, we're going to try to have some great content and share it with you all. So thank you so much and have a good night.